The return of Santa Ana winds bring warm and dry weather, but it also changes to your allergies. I feel it like right here. Dr. Abby from Sharp-Rise Steele is joining us to talk about how to relieve some of these common symptoms of the year. Out 'tis the season for allergies, Dr. Abby. Good morning. Good to see you.
It's good to see you.
Yeah, a lot of times my kids come home and even I feel it. I start to get it right here and then I'm confused. I don't know if it's allergies. I don't know if it's like the wind kicking up, if it's the temperature changes. So what is it usually?
So it's all of the above, essentially. So this time of year with the Santa Anas, they're obviously causing windy conditions, dry conditions. So all of that causes inflammation in your sinuses, and that is what leads to allergy symptoms. And so we tend to see that around this time. It's almost like clockwork. We start to get calls, people start to make appointments for it, and so we can expect it.
What are the common symptoms to know that you're maybe having a reaction or it's an allergy?
So it's all the E's, right? Where you get teary, you get sniffy, you get sniffly rather, you get sneezy, drippy, all of that. So watery eyes, itchy eyes, you have runny nose, some people actually have sore throat. Sometimes even when you have a nagging cough that doesn't go away, that can be from allergies because they can cause postnasal drainage and cause all of those symptoms. And it can be very, very annoying to deal with. People tend to get worse when they're outside. They sometimes will get worse seasonally, but sometimes they can have it year round. So these can all be symptoms of allergies.
Those E's that you just mentioned also, they sound like a cold.
Yes,
right?
Absolutely. That's a very, very good point. Yes, they do go hand in hand with cold symptoms, so there's some overlap there. But it's important to know that when it comes to allergy symptoms, those tend to be more gradual. Cold symptoms are sudden, and then big distinguishing factor is fever. So if you have fever, know that that's not from allergies. That can be from something else. So that's important to keep in mind. But allergies tend to be more gradual when they happen.
Okay, let's say you have the allergy thing going. What are things that you can do? Is there medicine? Do you go to a doctor? What are you supposed to do?
Yeah, so if they're mild, which most people do have mild symptoms, then you can start with just home remedies. So those saline rinses are very good.
The ones that you put in the nose, like the spray or the pot that you...
Exactly.
Okay.
Exactly, because a big part of this is that the winds, the windy conditions will carry what we call particulate matter. So all of the things that hang around the ear to cause pollution. So dust, even ash from wildfires. Even if the wildfire was a year ago, it can carry that pollen. It carries all of that into your nasal passages. So those saline rinses can help to get it out. You can use what is called a neti pot, which is easier to use. Make sure you use it with distilled and not tap water.
Why?
Because you can get, unfortunately, a brain infection potentially if you use tap water.
Did you say brain infection?
Yes, you can. So wherever your water source is not necessarily completely clean and clear. So there's a very rare chance of that. So you always want to make sure if you're using a neti pot that you use distilled water. And then medications, right? So over-the-counter antihistamines, common names are Zyrtec, Claritin, Allegra. You can also use nasal steroid sprays, Flonase. That's also something you can do. Make sure you're not using decongestant nasal sprays for more than 3 days. So we see that a lot because there's a different kind of nasal spray called Afrin, is a common brand name or a generic of that. Don't use that for more than a few days. And then if you're not getting better, of course, let your doctor know.
Yeah, one out of my 4 kiddos, there's one that usually comes home and he starts moving his nose around and the allergies. So we try to be a little bit more mindful with what we give kids. So what is available for kids that's safe for allergies?
Yeah, so it depends on the age, right? So always make sure that you look at the age ranges of the over-the-counter medication. So depending on the age, you can use the same things that you use for adults.
Oh, really?
Yes, absolutely. But when they're much younger, unfortunately, it is limited. You have to try to just clear out their nasal passages. They make these suction things that you can use to get it out. I know it's hard. You know, my patients tell me, have you had a child? do you know how hard it is to get them to do that? You know, so, but that does help with it. And it's really the same thing. So children and also adults can have chronic respiratory conditions called asthma, for example. So allergies can make that worse. So make sure that you're mindful of that. If they start wheezing, then you want to make sure that you let your doctor know. You want to have all their inhalers on hand because it can often go hand in hand with that. So that's important to remember.
All good advice. Here we go into allergy season, Dr. Abby. Thank you for being here.
Yes, it's good to see you.
Good to see you.